Hi, I'm Dr. Miner. Today I'm here with a patient that we're going to start the implant process on. We're going to do the surgical part where we actually place the implant into the jaw. And this all started with a tooth that had a cavity on the side, which became that if we try to do something with that tooth, it's going to really compromise it. So we decided to take the tooth out and place it with a long-term solution with an implant. And when we took the tooth out, we bone grafted, put bone in there to help preserve the area so we have good bone for the implant. Now, how was that for you when we took the tooth out, we extracted the tooth?
Well, there's been some pain, of course, but a minimal amount. I didn't notice that pain as much as I noticed the tooth being gone.
Okay.
It's healed over nicely. As far as I know, the graft is held in place with the sutures. Sutures came out easily, and I've been looking forward to having that hole replaced with a new tooth.
All right. So we're going to start that today, and first thing I'm going to do is get our patient numb. Now, oftentimes I get asked, why do we replace teeth? Which is a very good question. And there's many reasons for that. One is just the functionality and the look of it. Another reason is that when teeth come out, the bone in that area shrinks, and it not only affects that area, but the teeth on either side. And so what happens is the bone starts to resorb away from the tooth next to that area, and then it compromises those teeth, which then puts those teeth at risk for them coming out. So as putting an implant in, it helps to preserve that, preserve the bone, and keep the other teeth in good shape. Now, another question I get asked is, am I too old to have an implant? And the answer for that is no. Because how old are you?
77.
77. And so there's really no age restriction. And up until about maybe 6 months ago, my grandma set the record, I guess, for the oldest person I'd done an implant on, which is about 80, she's about 86 at the time, 85?
89.
89 at the time. And
She's now 93.
She's 93. And now, about 6 months ago, we had one of our patients that asked for an implant, wanted an implant, and he is 90. And so we expect that that's going to work just fine. Age is not a factor. Alright, so we got all done. Went pretty smooth from our standpoint. Got the implant in. We put on what we call a healing abutment and placed a couple stitches. to help hold the tissue together. And how was it for you?
Smooth. Went well. Thank you for the deadening. Obviously, I felt that. It procedure was well explained. I appreciate you visiting with me as we went along. That was really good to know what was happening and the implant and what the material was, the procedures you were going through to increase the size of the hole and get the final setting in there. It was impressive. And this is feeling very, very nice to me right now.
Good. And so we gave him some long-lasting anesthetic, which we anticipate that lasts around 4 to 6 hours. And it seems about 9 out of 10 patients say the extraction hurt worse than the implant. And so what we typically see is just more tenderness afterwards than a real hurt. And ibuprofen or Tylenol usually works great. And so we're going to let this heal for approximately 3 or 4 months, maybe sooner, depending on the healing, and then we will start with putting the crown on. So it's been a few months now since we did the implant, and how did that feel after we did that, and how does it feel now?
It was a little tender for a day or so, maybe, but
Okay.
it's been no problem at all. I can feel it with my tongue, of course, make sure that it stayed in place. You know,
Okay.
it's great. Felt
All right.
wonderful.
Okay, so that's pretty typical. You know, a little tenderness for a day or two, and then as it heals, really don't feel much. And so today we took the impression for the crown, to make the crown, and so at our next visit we're going to put the crown on, and he will have a new tooth. We have the implant crown back, and so today we are going to put the implant crown on and give this patient his tooth back. You ready to do that?
Yes, sir, doctor.
All right, here we go. We got the crown put on, went really smooth. We had a little bit of adjusting, and we did what we call a screw retained crown. So that is where all the components of the crown are made as one piece, and so it screws onto the implant, and that makes for a more stable implant, that rather than it being cemented where the crown could pop off, you know, with something sticky. Since this is screw retained, this is going to stay on, and we'll get a long-term good result. So now that we're all done, you know, this has been quite a process. It's taken several months from when the tooth came out, we put the implant in, and now we finally have the crown on. Now, how does it feel?
Thank you so much, doctor. It feels amazingly wonderful. Very comfortable in how it feels, and it's amazing how natural it looks. Thank you so much.
All right, you're welcome. Thanks.